Welcome back. It is exactly 9:40 a.m. South African time. We're crossing over to the UK and we're going to be joined by Dr. Ahmed Habib. He is a chest surgeon and he is going to talk to us about his journey through Gaza's devastation. He spent some time there. He's just gotten back home now, and we're going to be getting a an eyewitness account of his experience whilst he was in Gaza. Dr. Ahmed Habib, Salaam alaikum, welcome to the program.
Walaikum assalam wa barakatuh. Thank you very much for having me here with you to describe what's happening with our brothers and sisters in Gaza.
How
Um,
did it, how how did it happen that you landed up in Gaza as a doctor to go and treat the neediest of the needy? Did you apply to go? And you off air just told me that you returned home on the 10th of July. I'm kind of wondering, um, how did you prepare mentally for the journey, knowing the horrors that you are going to be faced with, the horrible, horrific wounds, and just the situation that we've seeing live playing out on our TV screens and on all other social media platforms. So, really, how did it come about that you decided to go knowing how dire and dangerous the situation is in Gaza?
Sister Julie, I don't think it's an option. I don't think it's an option.
Ah,
I'm a chest surgeon, which means that statistically, the commonest injuries that can be saved and and uh, and avoid death are injuries to the chest. And if dealt with in a timely manner, the patient goes home safely, no amputations, nothing. So it's a blessing from Allah Azza wa Jal that He's given me this ability to operate on chest injuries, and I don't think I will be spared on the day of judgment if I don't go. With regards to the horrors, Allah Azza wa Jal says in Surah Al Imran, قل لو كنتم في بيوتكم لبرز الذين كتب عليهم القتل إلى مضاجعهم. Allah Azza wa Jal is telling us to those that say that if we were at home we wouldn't have been killed, we wouldn't have been in this situation. Well, can we guarantee while we're very secure, sleeping on our beds, in our bedrooms, not dying? No, we can't. So death will come wherever it is, wherever we are. The other thing is, this is not my first visit to Gaza. Allah Azza wa Jalla, Alhamdulillah, blessed me. This is my third visit. I've been there, Alhamdulillah, from one of the first missions in January 24. I've been there in December 24, and this is my third visit, Alhamdulillah.
subhanallah, subhanallah. May Allah subhanahu wa ta'ala accept all of your efforts. And I pose that initial question knowing what the genocidal um, Israelis have done regarding medical health professionals, medical facilities. They've destroyed almost all of the clinics and hospitals in Palestine, in Gaza itself. And knowing all of this, Alhamdulillah, you have chosen to go, as I should imagine other medical health professionals from around the world. The Israelis are not even allowing um, basic necessities like food and other medicines to get through. How is it that they allowed you to go through?
So that's a very good question. So basically, there are organizations who go through extensive paperwork with the
Ah,
United Nations, and then
okay.
we apply through these organizations, and they do the paperwork for us, and it's up to us to be at the entry point. In this instance, it was Amman in Jordan, and at 6 a.m. in the morning, we meet at the meeting point, and then we take off in buses. And even though the trip is about 2.5 hour trip, it takes usually 15 hours through the checkpoints, through the Israeli borders in the West Bank, through Gazan borders, and so forth. And we're usually deployed to a certain hospital where we're taken to, and that is usually agreed at the beginning. The final agreement to enter at the last point is usually accepted by the Kogate, the Israeli Kogate, in the last minute. So I have had colleagues who have come from halfway around the world, Canada, America, other places, and in the last minute they just turn them back. So Alhamdulillah, it's a blessing that I had not been turned back. In this deployment, I was in the central region, but in my prior two deployments, which were very different, I was in the south.
So, we've been we've really been following this genocide firsthand, as I've indicated, through social media. What were the conditions like in the hospitals, and the types of injuries you've seen? Were you able to operate in an environment that I, I'm sure was not conducive to helping all of these victims? But despite that, how did you manage to then do all the work that you had set out to do?
Okay, so in this particular mission, the injuries were two main problems facing us. First of all, is the injuries were made to kill in a mass collection. So we would, on a daily basis, at the time of the food collection and the food distribution, we would see floods of patients come through. Ashuhada Al Aqsa, which is in the center, it's one of the smallest hospitals. It is not a big hospital. Would receive between 200 to 500 casualties per day, and the patients are completely malnourished. These are patients since March that have not seen any fruit, have not got any vitamin C, have not got any proteins. They're all skin on bone. The skin incisions are not healing. The wound that you're seeing on the screen now is a venflon, which is a small prick, and her skin disintegrated. This is actually better than w- w- in the past. Her skin on the dorsum was completely eaten up, and this is a young lady that was very well off, that was a freelancer, and they targeted her while she was working with others in Wi-Fi in a cafe, destroying everyone in that cafe. And her heart stopped, and she spent months in hospital, months with operations until she came to me at the end.
I'm
The other
sorry that
lad,
I'm responding like that. I've just seen the visuals of those young boys, and I can't believe what I've seen. Have those boys survived, and did you, in fact, work on them?
so that lad in particular was a joint procedure between me and the plastic surgeon. The plastic surgeon, mashallah, Mahmoud, he managed to reconstruct the nose, alhamdulillah, and the boy went home very safely, alhamdulillah.
Okay,
The chest injury,
I just want to put out a disclaimer. There are very horrifying visuals that we will be playing out now. And I think, as horrified as I am, I'm absolutely cringing here. I can't even bear to look at it. It really is not for sensitive viewers, but I do believe we need to put those visuals out on air so people can see the horrors and the atrocities being perpetrated in Gaza. So I've just given the thumbs up to my producer to put those visuals out. And Doctor, I'm sorry for the interruption, but do continue. Thank you.
so no, yeah, that's fine. So if we can keep that last image up. So these are two photos, and this is a sample of what you see on a daily basis, where I'm called in and I'm calling to see three mass casualties at the same time. Each one of them is more critical than the other. On the left-hand side is 14-year-old Abdullah. He's been blasted, and shrapnels have gone through his left shoulder, and he's drained all his blood down the drain. His heart is about to stop. His blood pressure is in his boots, and I had to take him immediately to theaters. At the same time, Sister Julie, the X-ray in the middle is for a man who was more in the center of the blast, and his ribs got broken, and he could not breathe at all. The whole breathing mechanics was distorted, and he was about to arrest on 100% oxygen. And at the same time, a professor in neurology, one of the only professors left in neurology, Dr. Iyad, in Gaza, was blasted as well in the same attack outside of another nearby hospital, and shrapnels went in through, and just inserting the drain drained 2 meters, which is about a third to half of his blood volume. So I had to prioritize who's going to go to theaters, who's going to be treated, who's going to be, who can wait. Alhamdulillah, all three survived, but it was very difficult. I had to externally fixate the patient in the middle. Dr. Iyad was managed and resuscitated on bed, and the young boy who was about to stop his heart was taken straight to theaters, and there is no bleeding because there's absolutely no blood in his bloodstream. I opened with a knife, skin down to bone. Skin down to bone. There's no bleeding, there's no blood left, and there's no saw to open his breastbone. I had to use a chisel with a hammer,
Oh,
which is an obsolete instrument. An obsolete instrument. I had to hammer through his chest. Subhanallah. And when I
s-
reached, his heart just stopped. I had to hold his heart in my hand and internally massage it. It was very stressful, sister. Very
so
stressful.
So, as you performed all of these life saving surgeries, Alhamdulillah, you back in the UK. Is there any way for you to track the progress of those patients and many other patients you worked on? You talk about the blood having drained out of the patients. That also indicates to me that there's a huge need for blood supplies in Gaza. But whether the genocidal Israelis will allow blood supplies, they're not allowing food, baby formula, and other medications to go through. Will they even allow blood supplies through to Gaza?
Sister, one of the doctors with me donated his blood twice. Twice. He was anemic before he left. It's all internally managed with the minimal resources. And don't think it's sterile or to optimum conditions. It's what they can do. Some of the doctors were dropping, fainting with me during the job. Many of the nurses were killed. Usually there's a 1 to 4 nursing allocation. This is not even a 1 to 40. A lot of resources have been gone, and even getting the resources in, we have to keep it in our bags and take whatever we can carry. So usually you can carry 2 big luggages. Alhamdulillah, with the help of other people, I managed to get in 5 luggages. But that's not enough, obviously, and we have to deal with what we've got, and many will die. I have left patients die because there's no equipment, or because if I use the resources for one patient, 2 other patients will die.
So it's a triage situation. And I kind of wonder how you grapple with something like that. It can't be easy. It must weigh very heavily on you.
It's
I
it's
just don't know
very
how,
difficult.
yeah, how people like yourself who go out to do humanitarian work is faced with a situation where you've got to decide whom you're going to help, try and make that person live, and whom you give up on. Uh, I can't even begin to imagine how difficult that must be for you. How do you cope with something like that? And when you get back home, what are the resources at your disposal to try and help you deal with
Well,
the horrors and the decisions you've had to make?
sister, I won't lie to you. It is very, very difficult. It is very stressful up until now. It is very, very difficult.
Allah give you ongoing strength, inshallah. Will you be going back sometime soon? And as you've indicated earlier on, there's a lot of red tape and scores and scores and scores of forms to fill out before they let you go again. Is that part of the plan? Will you be going sometime soon? And what is your message to healthcare workers around the world, around the globe, that want to make a difference, that want to be a part of this change? that want to truly uplift humanity by going to Gaza and doing some sort of humanitarian work?
I think the message is um, that there is a massive need. Whatever we do, we won't be able to fulfill it. What we're seeing in front of our eyes is destined by Allah Azza wa Jal, and there is a massive change coming. We will be judged for how we played our role in this, and and we should not be stand-byers. We can't be stand-byers. Allah Azza wa Jal will judge us on the day of judgment. What did you do? Have you tried your best? Why haven't you done this? Why haven't you helped out and reached out? And this doesn't go just for doctors, for each one of us. Have we done our best? Have we tried our best?
Are you going to apply to go back again sometime soon?
Inshallah. Inshallah.
Ameen.
Definitely inshallah.
All right, you were there firsthand, dealing with patients with the most horrific injuries, etc. What else can you tell us about the situation there? And I'm sure you were probably working 24/7 for the time, in the time that you've been there. But what more can you tell us about how dire, in fact, the situation is?
So you just saw a child who's 16 and the shrapnel shivered his food pipe, subhanallah, and his treatment was extremely difficult. I don't know if you've seen during the records another lady who the bullet, they target usually collections of people, and the bullet came from the top through the chest and severed the right chamber of the heart, opened, subhanallah. And she's just 19, she's a nurse, year one nurse, and she was sitting with her family in the street in the north. And it's very difficult to move around because there's no ambulances. These patients are brought in either by their relatives or by bypassers. A lot of the time, we have no clue what the name of the patient is or the child is. We don't know, and there's no one to hand them to. And the relatives are lost or dead. Or dead. Many are the only survivors in the relatives, and maybe this is their last survivor, and they're gonna finish. The names, this family is gonna be wiped off.
Early on, I asked you the question. I mean, you dealt with, in the time that you were there, you dealt with really life and death situations. And what you've shared with us and the pictures that we flashed on screen, we could see just how serious those cases were. You're back in England now. Is there any way for you to track the progress of those patients that were literally on death's bed?
Some of them I can't. I've lost track. Some of them I've lost track. Um, but some of them I have. They have my phone, and from time to time, when they get Wi-Fi, they send me a message. Some of them I try to get hold of the doctor that rotates in the hospital. When they're well enough and they go to the hospital, they try to keep me up to date. They ask me about new patients. The starvation situation is horrible and horrendous. We are seeing patients, 27-year-old patient who a simple chest infection is destroying him and he's dying on the ventilator. Why? Because there's no immunity and there's no other cause other than his nourishment to explain massive deterioration. The wounds are not healing. You saw the 16-year-old boy, his wound now is 5 or not coming up to 6th week, and the wound is not healing because there's no protein. He's skin on bone. When starvation happens, it does not happen overnight. The body copes with quite a lot before you drop dead. It starts to eat up all the fat stores, if there are any fat stores, and then it eats up all the muscles. So you see the pictures on social media where there's no muscles and the skin is all on bone. And then after that, the heart stops and they start to faint and they start to drop dead. This photo is the photo of a trajectile of the missile, the bullet, that I talked to you about, the 19-year-old nurse, and it sliced the heart. Alhamdulillah, she went home safely and she's well, and she's in touch with me, alhamdulillah. But many others died, and they're young. I've dealt with 8-year-olds and younger
Uh,
patients, subhanallah.
those those patients, or the majority of the people in Gaza who are now undergoing, due to starvation, as you've indicated, skin on bones, they're in a situation of famine, extreme famine. Most of them will die. They're not going to make it. But for those who survive, and let's just by the mercy and the miracle of Allah subhanahu wa ta'ala that this horror stops in Gaza, what is it going to take for medical professionals like yourself to go in and save those people? We know that just giving them food and hoping that they're going to now survive, fatten up, it's much, much more complicated than that, medically speaking, is it not? And how long will it take for those patients to get back to as normal as we possibly can get them to?
Some of them, I mean, not some of them, a lot of them will have permanent disabilities. There is a massive number of patients who are paraplegic, and they will always be reliant on support. Other patients have other forms of disabilities. Some of them have lost parts of their lungs. They will always be debilitated, always be disabled. And it's not that easy. Other cases, for example, cancer patients, some of them have died. Some of the slower growing cancers are still alive, and they need attention. So it's not like the war is going to end and you're going to open the doors and everything's going to be fixed. This is going to need endless support, some of it with permanent disabilities, some of it will be fixed in the short term, some never ever.
So it's going to be literally a broken nation going forward. It's going to be probably 50 or 100 years where one will see some form of normality in that society. It's also going to take a lot of work from Muslims and human beings, humanitarians from around the world to work really hard in getting Palestine and the Gazans in particular back to what you and I know as normal. So it's going to take 50 to 100 years. Would I be correct in thinking and saying that?
You're absolutely correct. It's in another generation, Sister Julie. It's another generation. This generation has seen things that have not happened in history, have never have happened in history. And this famine that we're seeing in front of our eyes is man-made. Have you ever heard about a war where starvation happened and the people were killed live in front of the world's eyes?
And nothing's being done. And governments around the world, specifically Western governments, um, are still not waking up to the horrors playing out right in front of our eyes. We're going to have to leave it there, but I'll give you a few minutes to summarize, to wrap up, and to cover something important that I might have missed to put to you during the course of the interview.
Uh, there's a duty of every one of us. This month, a lot of the medical missions have been cancelled, and with the visit of Steve Witkoff claiming that there's no famine, I can see that the intentions are to continue starving the people of Gaza with the intention of completely finishing them off. It is up to each and every one of us to raise their voices as loud as possible for ICC, for social media, for parliaments, to go behind closed doors, to go openly and try to stop this from happening. People are dying, and the intention, I can see it clearly, is to finish them off. With these events that happened in the last few days, the intention is to finish them off this month. Allahu Alam. And this is not up to them. Allah Azza wa Jal is above them all. But it's our duty to try our best. Please raise your voices. Please do dua. Please donate. Please do whatever you can. Everyone knows himself. Everyone knows what his abilities are. Search between yourself. What are you going to say to Allah Azza wa Jal on the day of judgment? And act based on that.
Inshallah, may Allah subhanahu wa ta'ala keep you safe. May you continue doing what you're meant to be doing, that is saving lives, and all of your colleagues, family, friends in the areas that you move in. May they all also become conscientized through this interview and, of course, through all of the other social media posts and stories we're seeing, that the tide will turn. And there is, inshallah, hope for the people of Gaza and Palestine. The Palestinian do get right to return, and this horrific genocide is stopped for once and for all. May Allah be with you, Dr. Ahmed Habib, chest surgeon based in the UK. It was wonderful talking to you. Horrific pictures, I might add, but important for the world to see the horrors being perpetrated on innocent men, women, and children in Gaza. Till the next time, as always, Assalamu alaikum to you.
Wa alaikum salam.
And that brings us to the end of the interview for today. I'm absolutely shocked. I'm just looking at those pictures have, gosh, traumatized me. Um, I can't even begin to imagine what these doctors are going through that work on these patients. I can't even imagine what the parents and the families of those patients are going through. Allah make it easy is all I can say. Continue du'as, inshallah. And a reminder that Alhamdulillah, we kick off with our very special women's program today at 11 o'clock. We will be running this very special program for the rest of the month of August. We will be featuring amazing women making a difference in the community and globally. So please, please, please do stay tuned to the Women's Day program starting today at exactly 11 o'clock. And the beauty about this program is that each week we'll be having a different woman presenter putting forth her views, her guests, and her topics throughout Women's Month. Happy Women's Month to one and all. And from me, till next week, Monday at the same time, as always, stay safe and Khuda Hafiz.